Thanks, Nico. I can see that it's recorded from now. So I would like to welcome you, everybody. Welcome to our today's Gateway online event dealing with digitalization, Nepal's health sector. I'm Sibyl Tushta. Maybe you know me already from the Gateway community, where I'm facilitator and moderator. And I'm happy to have Nico with me again today here.
Thanks, Sibylle. So my name is Nico Lück. I'm consultant at the Competence Center Digital Society of the sectoral department. And I'm facilitating the GIZ Digital Gateway, which offers information, exchange, and answers to all questions on digital issues within GIZ. We have these events, these webinars, every 2 weeks, Friday morning on Wednesday afternoon. All the times and information on these events you can find on the Digital Gateway. And yeah, Sibylle just posted the link to the gateway.
Yeah, thank you, Nico. We would like to ask all participants to mute their microphones. I'm not quite sure. There was some background sound. Okay, so today we have Saurav Bhattarai with us, and he will share with us their insights from the new publication, Digitalisation. Help me, Nico. Digitalising.
Yeah. Digitalizing Nepal's
yes,
health
we
sector.
got it. Thank you. So we are very excited about it, Saurav, but maybe in a minute, because first we want to clarify the organizational issues.
Yeah, right. So as usual, mics are or should be muted. We will have the presentation first, and then afterwards the discussion. While the presentation is going on, you are invited to share comments, questions in the chat. Sibylle and me will collect these questions and post these afterwards. And again, we are recording the event, so we're recording video, audio, and chat, and you will find all the recordings afterwards in an archive page on the gateway with the presentations as a PowerPoint file.
And let me please just quickly share those links with you to find the presentations after the event and also next online events. Okay, and now let us stop talking and let's share some welcoming smile and applause, virtual applause, in the chat with Saurav. Saurav, how are you? Microphone
Good.
on?
Yes,
Perfect.
I think so.
And the webcam too? Cannot see.
Let me...
Perfect. Nice to see you. Let me just start your presentation. It starts now. It should be visible for everyone. And maybe, Saurav, you just take over the presentation to go through it. Perfect. Yeah, it should work. So the stage is yours. We are very happy to hear more about it.
Good afternoon to everyone. Good evening to some of my colleagues who are in Nepal. I see a few on the list. Today, I will be talking about a new publication that has recently been launched called Digitalising Nepal's Health Sector. My name is Saurav Bhattarai. I work for the Support to the Health Sector program here in GIZ, Nepal.
Saurav, sorry to interrupt you. I still cannot see you, but I saw you in the meantime. So
well, no, I paused the video to get the audio better because for internet connection issues.
Okay, perfect. Thank you.
All right. So just in terms of the publication is titled Digitalizing Nepal's Health Sector, a Country's Journey Toward an Interoperable Digital Health Ecosystem. This is a case study of the German health practice collection, and as all studies of the GHPC, this was selected through a peer review process among various German development cooperation experts worldwide. This effort is coordinated from the sector program Profile. My colleague Carolina is on the call, a special thanks to her. Corinne Granger is the author of this piece, and has been edited by Anna von Royne. and they have spent a lot of time and effort on this publication, so special thanks to them as well. And as all GHPC publications are peer-reviewed, this one has been peer-reviewed by Dr. Alvin Marcello of the Asian eHealth Information Network and Mark Landry from WHO. So overall, this publication is based on the work that GIZ and KFW have done together here in Nepal, and roughly ranging the publication has content based on the work that we've done from 2015 onwards to at least the middle of this year. So just a brief overview of our program here. So the Support to the Health Sector program is a health system strengthening program with 5 major components. We work on social health insurance, human resources for health, governance in health, digitalizing HIS, that's health information systems and work processes, as well as adolescent health and development. And as you could guess, today's presentation will be more focused on the work in digitalizing HIS and work processes, but it has its it touches on the other health issues as well, the other thematic areas. So when we set out to work on digitalizing the health information systems and work processes, we're looking at 3 major things. We wanted to make quality data available at various levels of the health system within Nepal, at various administrative levels and service delivery levels. And we wanted to promote the seamless exchange of data and information between various systems. As in many sectors, even in the health sector, there are generally a lot of different information systems custom built to solve different problems. And rather than having one large system that does everything, generally what happens is we have smaller systems that solve specific problems, but it's always nice to have them work together and share data between each other so that they function very seamlessly. And the third one where we wanted to focus on is gaining efficiencies by streamlining processes using digitalization within the health sector. But as we were working on these 3 major areas for strengthening the system, so not taking digitalization for the digital aspect, but actually as a means to an end to strengthen the health system, we realized that 2 key things were very necessary: an overarching vision for the digital health ecosystem in the country, as well as the need for developing digital capacities among various stakeholders, government, non-government, private sector. So these 2 were quite key. So as we went on, we started working on the governance aspect. So this isn't, when I mean governance, I'm not talking about electronic governance as in where we generally link digital and governance, but this is more about the governance of the digital. So for this, the Ministry of Health in Nepal, we worked with the Ministry of Health in Nepal to define an e-health strategy, which was officially launched in 2017. And this strategy promotes a cost-effective, standardized, efficient way to use e-health solutions and applications in the country. So this document is the basis for all the digital health work that we're doing and trying to make interoperable information systems around. And together in this governance component within digital health, we were also able to convince the ministry, and the ministry saw the need as well, to establish a focal e-health unit within the ministry. So this unit is now our go-to counterpart within the Ministry of Health for all digital health related issues. And as the governance started shaping up, what we really lacked in terms of technicalities was a common architecture, so that when we're talking about multiple information systems being linked to each other, we need a common architecture, the ecosystem, so that these different entities could talk to each other, a common language. So we set out together with the Ministry of Health to put in some set of standards to make multiple information systems talk to each other. So, and these standards were adopted from an open source project that's out there called the Open Health Information Exchange, which is not an open source software, but it's an open source framework that helps countries think through interoperability and making systems compatible with each other within an ecosystem. So I'll get into now details of how we conceptualize this architecture using the openHIE framework and how we work towards making an interoperable system. So it all started with core registries. So if you look at this image, we have the Human Resources Registry, a Health Facility Registry. So I would describe this as being the vocabulary of a language. Right? These are the core words that are required, the core words that everyone uses so as to speak the language. So the Human Resources Registry contains a list of all human resources for health within the country. The same with the health facility, a list of all health facilities in the country that can be uniquely identified, that is shared among different information systems to achieve interoperability. So the Ministry of Health has already embarked on the journey of creating these registries. Not all of them that you see here are fully complete, but the Health Facility Registry is complete, and the Human Resources Registry and the DHIS2 Indicator Registry are in a very mature stage as well. And after we had the vocabulary for a language, we set out to define some grammar. Right? So this is the interoperability layer, and this layer helps different systems talk to each other using the vocabulary that's in these core registries. So this would mean that information systems in hospitals, there can be various information systems in hospitals. Now, using this interoperability layer, these hospitals can talk to the health insurance and exchange information about their claims, about what services they've provided. And also, these hospitals can report their service data to their administrative body or their governing body in the municipalities, as well as report their data to the Federal Ministry of Health and Population. So because of this interoperability layer, all these different connections are possible. And when we fill this all up, this is what we ended up with in terms of, so everything at the core lies with the Ministry of Health to define these standards. So this is the vocabulary, the interoperability layer surrounding it is the grammar in terms of defining how to use the different words to shape sentences, and then the communication between the various information systems and the ministries and the municipality. They take advantage of this language and communicate with each other very interoperably and gain efficiencies and reduce duplication. Another core aspect so once we have the interoperability part laid out, the other is capacity development, equally, if not more important. And in this, our program, GIZ program, has been working very closely with the Ministry of Health to promoting the concept of learning through peers. So we've helped the Ministry of Health become a very active member in the Asian eHealth Information Network, and this is a loose network of countries and different organizations working in digital health in the South Asian region as well as beyond, where a lot of peer learning is encouraged. Workshops, regional trainings are organized, as well as study tours between countries. So a lot of South-South sharing, a lot of know-how in terms of real implementation, what the issues are. So we've been supporting the ministry be a part of this, as well as more on the global level called the Health Data Collaborative. This is the WHO and other organizations, including GIZ. We've been supporting this effort as well to have better data systems within the health sector, and we're a big part of the Digital Health and Interoperability Working Group within the collaborative. Another way which might not seem very intuitive for capacity development, but which has worked well for us, is building global goods from local knowledge and experiences. We've used certain tools, and I'll get into the detail of the tools a little bit later, but using openIMIS, an open source tool for managing health insurance. We are very much a part of the global community of this open source tool, and our partners at the Ministry of Health and the Health Insurance Board have been sharing a lot of their experiences to the global community about how they've been using this software and what their issues are. And this exchange of knowledge also helps a lot in building capacities within Nepal as well as beyond. But just the reaffirmation to a lot of people that others are also facing the same problem really helps. And this has been something we've used quite extensively, and this is quite aligned with the digital investment principles. These are a set of principles that GIZ has also endorsed in terms of how donors can align their investments for digital interventions. I would really encourage you all to go to this link at a later stage and read through it. It's quite interesting. And just like in openIMIS, we're part of other global digital health communities as well. openHIE, as I've already mentioned, DHIS2, BAMNI, openMRS, these are different digital health tools that I will get into detail of in the coming slides. But again, capacity development has been a big part for us, and it has really helped us propel a lot of the digital activities within the country and actually gain considerable results. So, and even among capacity development, peer-to-peer learning has been really big for us. And now I'll go into some of the tools that we've been using. So as I said before, we focused on data quality improvement. We want to focus on data quality improvement, streamlining of work processes, as well as creating interoperable systems. So in terms of data quality, we use a software called DHIS2. And this is a software that was developed in South Africa in the early 2000s, has now very deep roots at the University of Oslo in Norway, and is used in more than 50 countries to manage health-related data and even beyond, health and beyond related data. It's a really good data management, visualization, and analytics tool, and it's very suited to the health sector as in easily customizable and easily scalable, and it helps countries really save resources on software development. So in Nepal, we use, GIZ has been supporting the Ministry of Health to use this software, and we've been successful in making DHIS2 the software to manage the National Health Management Information System, a system that collects more than 25 million data points per year. This is thousands of data points per facility in the country every month. So a lot of data is collected, and this is all service statistics from these health facilities. So with this system, with DHIS2, we've been able to really take digitalization to the grassroots in Nepal. So health facilities are able to use this tool with a decent internet connection and a computer. They can use this tool to electronically report their own data, something that we've introduced in over 400 facilities now, with co-financing support from the Korean Agency for Development, as well as the Global Fund to fight AIDS, TB, and malaria. GIZ's efforts combined with these co-financing have really helped us scale up this effort, going to more than 400 health facilities and training more than 1,000 people to use this software to report and analyze and interpret their data electronically. Another tool that I've mentioned before is openIMIS. openIMIS is an open source insurance management information system currently being used in Nepal and Tanzania. openIMIS is more than a software in terms of it's a global effort to create a global good, and the core of this lies at the sector initiative, social protection. Within GIZ, we are working together with the co-financing from the Swiss Development Cooperation to make this software better and applicable to many other countries and insurance schemes. In Nepal, it is the one and only information system being used to manage health insurance within the country, and it works online and offline. It's tailor-made to low resource settings. We take advantage of Android mobile phones while having online and offline functionality, and it is enabled to have cashless transactions at health facilities. So people without cash, and if they're registered in the insurance, openIMIS allows them to receive services and not have to pay cash and get reimbursed later. So it's a cashless system in that respect. In terms of scale, we've used openIMIS to enroll more than 870,000 members into the national health insurance in Nepal. Over 600,000 claims from these members have been processed, and they amount to more than $5 million in terms of value. And this money has been reimbursed to health facilities by the government of Nepal based on the data collected and managed by openIMIS. And Nepal is a big part of the global community, and we're working together with the sector initiative to make the software better. So just as an example, if you look at this, this video shows enrollment being done at various parts of the countries.
Saurav, we cannot hear you anymore. Maybe it's due to the video.
Oh, sorry.
Oh.
Yep. So each dot represents a person being enrolled into the health insurance. And this is all data from openIMIS that has been able to, this helps managers of the health insurance see where they need to put in more efforts or where they've been successful. So as a planning tool, this has been really helpful. And in the picture, you can see like all these enrollments are done at door-to-door level. So someone from the health insurance goes in, registers people, and gives them their card as well. And another tool, again, to deal with process management, to make processes more efficient, is a tool called Bamni. This is, again, an open source tool. I think you can see a trend here. We really appreciate and use open source technologies and really shy away from using proprietary tools. So Bamni is based on a larger open source software initiative called openMRS, and it's basically a system that helps digitalize hospitals. So digitalizing every process within the hospital, from patient registration to digitizing their medical records and pharmacy and lab. So every process within the hospital being digitized. We are piloting this in one hospital, again through co-financing from COICA. So I think you can see a trend here as well. A lot of our work has been possible from co-financing. And our aim with just piloting in one is to make sure that the government of Nepal can have one generic hospital management system based on Bamni that can be used at any public health facility in the country. So we don't intend on scaling GIZ, going out to multiple hospitals and scaling this up, but we're more in terms of making a tool available that when there are resources available from the government, from the hospital itself, that they have something that they can take for free and actually implement and digitize their hospital. So again, this is also interoperable. It's designed to interoperate with openIMIS for insurance claims, as well as it reports the monthly statistics to DHIS2 directly. So that was a part of what we've been doing. There's much more in detail in terms of what we're doing. I would really encourage you to read the publication that's on the health.bmz.de website. But in terms of what's next for us is, as I showed in the previous slide of interoperability, that there's a lot of concepts out there, but we really want to work on making sure that these are actually feasible to move forward. So we're trying to establish a Nepal interoperability lab that links with international labs as well, that helps Nepal and GIZ together actually try out these concepts and see if they really work, and see where the pain points are, and fine-tune the interoperability parts as well. We are entering into a new partnership with the Global Fund, another continuation of the previous co-financing, and again, these funds will be used together to create the interoperability lab, as well as proof of concept for creating interoperability between information systems of AIDS, TB, and malaria, the 3 diseases that the Global Fund supports. And we will be looking into improving the civil registration vital statistics system in Nepal, as we get an extra €1 million commission from the BMZ in helping monitoring SDGs. And in terms of social protection, we're looking into ideas on how we can create digital solutions to have a unified beneficiary registry that allows different social protection schemes, including the health insurance, to see who their beneficiaries are and how to target them better. So that's another new avenue that we will be embarking on. And obviously, we will continue our participation with the global openIMIS global community, sharing experiences from Nepal, developing and testing new functionalities in the years to come. So that's generally what we see in the future for us. Lessons learned, I think I've touched on these as I went on, but we've really taken to heart that digital tools cannot be introduced just for the heck of it. It has to be a means to an end. And we see it with the Ministry of Health. As soon as they started seeing concrete benefits from having a digital system, the support that we at the GIZ program got there was quite an exponential increase in the support, and which has helped further the e-health agenda within the country. And as you've seen throughout the presentation, co-financing partnerships are really good for scaling up. Like if it was only for the BMZ funds that we had, maybe we wouldn't have had this impact, but co-financing really helps. And then again, peer learning is always a great capacity building tool. So with that, I will stop here and open up to questions. The publication is here for download. And yeah, so questions.
Well, first of all, clapping hands. Thank you so much, Sarah. I don't know what it was like for you. I was dropped off maybe for 10 seconds, but I hope you could listen and see everything smoothly. Thank you so much for your presentation, Sarah. We have collected some questions. I hope I have all questions. If your question is not on our list, please tell us again. But let us start with the first one. Nico, maybe you want to ask your question yourself.
Yeah, when you started your project and you had your requirements, and now you have all these software and framework solutions, how did you identify all these solutions in the first place? Did you do some kind of market research?
Not a typical market research in that way, because again, it was a lot of interactions with other governments and other partners that had gone through similar experiences. So I would point back to AHIN, the Asian eHealth Information Network. They have their motto, "Friends help friends," and that was it. Like whenever we ran into a problem, when we realized that we are lacking something, we would go to the AHIN mailing forums or talk to one of the members of AHIN to see what they had done, because clearly in this day and age, it's very difficult. It's quite hard to find a problem that you are the only one that's facing. There are other people out there that face the same problem. So we went out and talked to people who had similar experiences, and then we started choosing from these solutions.
Okay.
Okay, thank you. And the second question we have here was a question regarding interoperability. It was, I think, for slide 7. If we could go back to that slide 7. So the question was about interoperability and linkages to other sectors.
Okay, I think if I get you right, you wanted to know about how this connects to the other systems.
Yeah, if I can just thanks, Saura, for this presentation. So my question was, here you show how all the different data systems.
We cannot hear you anymore.
Can you hear me now?
Yes.
Sorry, yeah. I think I just dropped off. You were describing how all these different entities feed the data into the Ministry of Health. So the data lies with the Ministry of Health. My question is, are you able to connect to other sectors? Is the National Statistic Office involved in using some of this data? And are you able to link it, for example, to education or to, I don't know, climate or any other of these sectors? Thank you.
Yeah. Okay. No, that's a very valid question, and we've been thinking about it a lot. The problem arises when such an interoperability framework doesn't exist for the entire country, right? So beyond sectors. But what we've done, and in the absence of that, and still being mindful that we would need to connect it, what efforts Ministry of Health and us we've put together is, if you look at this, the inner core of the registries. So when we design these registries, we try to involve as many other sectors as possible and define linkages. For example, if we define a facility within the health sector, their addresses, where the codes for the different municipalities that they're in, the different provinces and whatnot, we try to align it with the Central Bureau of Statistics or the office that's responsible for providing standardized addresses. So we try to maintain, when the countrywide interoperability framework is final, we see that that's an opportunity for us to connect. And then the same with defining standard terms and terminologies. So that would be a big need, and that's what we're doing, working in the inner core. But I think we are mindful that we need to connect to other sectors, and I think most of the work will be done in the core and the interoperability layer of this framework that you see to connect to other sectors.
To follow up on this question, one remark from Beate was, from our experience, is there a need for from your experience, is there a need for global discussions on standards and interoperability of systems, or is this already in place?
There's always discussion necessary, and but there are platforms already in place. So openIMIS, which I had displayed on the slide before this, is such a global platform where, for at least for health, the different stakeholders are coming together to discuss possible standards and interoperability concepts that would be applicable within the health sector. But these discussions, they can't just be a discussion that happen once and end, because technology changes so fast. This is a discussion that needs to happen on a regular basis, globally as well as nationally.
Okay, thank you. There was a question about corporations. Could you tell us more about the cooperation with SDC to improve the openIMIS software?
Actually, I will point to my colleague Alicia, who's on this call, to answer this one, as she coordinates all these efforts with SDC and openIMIS. Alicia?
Yes, hi.
Perfect.
I am. Yeah, thank you, Vera, for this question. So the cooperation with SDC, it's also a co-financing agreement to the Sector Initiative for Social Protection. So we are the so-called project coordination desk of the openIMIS initiative. So openIMIS is not only a software, but also the community around this open source solution. So we are coordinating the technical development of the software. We are coordinating the community management or development, and also capacity building activities. This is the role GIZ has there. We are not implementers. I mean, in the case of Nepal, we are, but the software is made available for others to be used, to be implemented in their context. And you asked also for where you could look up for more information, and there is a webpage, openimis.org, and you can also reach out to us, to me, to Saurav, or other people from the team of Social Protection Sector Initiative.
Thank you. Thank you so much.
Thanks. So we have one last question. If you have further questions, please post them in the chat, and so we can collect them. The one question was, who designed and programmed all these interfaces between the systems?
Okay, so that's quite interesting. So there's not one agency or one set of people who've done this. It's been quite organic in its growth. So and we learn a lot from the global community as well. So there is, once the interoperability standards were defined, then we, or the framework was defined, then we looked into actual technical standards and how to connect them. I would take an example of the Health Facility Registry. So the Health Facility Registry in the core that we have here was conceptualized by the Ministry of Health. So these are when the computer programmers are not around, the Ministry of Health figured out what they wanted in a registry, and then it was contracted out to a local programming agency here in country, and they were able to create a database system around it. And now your question in terms of the interfaces. So now we needed the Health Facility Registry to be able to interoperate with other systems. And the technical ideas were there, but some of the standards were missing. What would be a good standard for other systems to connect? And then we were already part of the openHIE community. There's a lot of documentation there, and we looked at best practices from other organizations or other country practices. We adopted those standards and then got the same IT company to incorporate those in. And then different IT companies that are involved in other softwares, they were given these standards and they were able to program them in to their software so that they could communicate. So it's more of a team effort and quite a distributed effort, with the Ministry of Health leading the way in terms of defining the standards, and then the other agencies using them to actually program the interfaces.
Okay, thank you. I just had a question in the chat because I wasn't sure if we already discussed one question. So, Nico, you think we already discussed it? If not, please get back to us in the chat. It was about the role of GIZ, but I think we are through. So everybody, last chance to post your questions in the chat or just use the microphone. I would like to thank you, Saurav, and greet you because it's very late at your place now. It's already, I don't know, 20:30 in Nepal?
Yes, close to 8:30.
Okay, so thank you for that so much, for being here with us and to answer all those questions and present your project and your studies. And everyone has her or his answer. That's perfect. And I would like just to share a quick outlook with everybody. Next online event is Friday, November 30 at 9:30 German time. Again, it's the Yalla Makerspace, and it's Marios Muratidis from the Siegen University who will talk to us. So thanks for your lively contributions here in the chat and on the microphones. And if you like, check our upcoming events here. Take care, everybody. See you next time. Bye-bye.
All right.
And thank
Take
you.
care. See you. Bye.
Bye.
Bye.